introduction, and thanks so much for all of you for joining us today. We're so sorry we had some technological issues with our Zoom, but I'm so glad you're able to make it and join. And today's session, as Trish was mentioning, is a beginner's introduction to patient engagement. So if we can switch to the next. So I'd first like to start off by acknowledging that myself, Trish, and the Center for Healthcare Innovation are located on Treaty 1 land, home of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and homeland of the Métis Nation. And also, I'd like to acknowledge that Winnipeg's water is sourced from Shoal Lake 40 First Nation. And as a white settler on these lands, I feel immense gratitude to Indigenous people who have been the caretakers and who have lived and worked on the land since time immemorial. And in coming together today, we respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence faced by Indigenous peoples in the healthcare system, education, justice, child welfare, and government systems. And we dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. And really, in talking about patient and public engagement in health research, it's in fact Indigenous research methodologies that are at the forefront, and Indigenous scholars, researchers, and communities we should be looking to. We also believe that patient and public engagement must be grounded in a social justice and health equity approach. So here's a bit of an outline about what we'll be chatting about today. First of all, we're going to explore what is patient-oriented research. Then we're going to take a look at what is patient engagement. We're also going to delve into some of the guiding principles of engagement. And I always find that when defining and clarifying something new, it's also important to take a look at what it is not. So we'll also outline what isn't considered patient engagement. And then we're going to look at the core beliefs and why we engage. We'll briefly look at levels of engagement and some resources and tools that you might be interested in. And then we have a really exciting announcement at the end about our PrEP Awards. And because this Lunchtime Learning series is accredited by the Royal College of Physicians and Surgeons of Canada, I need to disclose that I am employed by the George and Fahey Center for Healthcare Innovation as a patient and public engagement lead. So let's start off with a question. What do you think is patient-oriented research? How would you define it in your own words? If you want to, you can feel free to share your thoughts in the chat box. Oops, I'll just take a look at the chat box as well.
And also, folks have the option to unmute themselves if they want to speak as well.
So maybe we're a little bit of a quiet group today, and that's okay. We started a little bit late, so we can actually take a look at what the strategy for patient-oriented research says. So the strategy for patient, oh, were there some? I think there were.
Yeah, we got a couple in the chat there. Brian says research about, for, and with patients. Like Sarah says keeping the patient engaged and involved in each part of the research process.
Perfect. You guys are already experts. That's amazing. You hit all the good points. So, oops, sorry, just a second. So the strategy for patient-oriented research is a national initiative funded by the Canadian Institutes of Health Research, and they define patient-oriented research as kind of a continuum of research that encapsulates 5 key components. The first one is that it engages patients as partners, and note the word partners, right? It's different than participants. This is where you have people with lived and living experience actually engaged as co-researchers, helping to do research decision-making about the process. We're also looking at focusing on patient-identified priorities, improving patient outcomes. Want to make sure that the research is conducted by multidisciplinary teams in partnership with relevant stakeholders and rights holders. and that it aims to apply the knowledge generated to improve healthcare systems and practices. So if you notice, I capitalize and underline the and just to say it's a continuum of research that encapsulate all of these components, not just one or two, but this is all of these components. Now, if we're to look at what we mean by patient engagement, I think you guys had some really good examples of how you would define patient engagement there. But we can take a look at, we can take a look at what, again, our lovely friends at SPORE, how they define patient engagement. And it's really seen as the meaningful and active involvement of patients and caregivers in the governance of research. So what we mean by that is seeing people with lived experience on steering committees, operational committees, even things like data safety monitoring boards of research. Also involving people with lived and living experience in the priority setting of research, as well as conducting of research. So we've seen people with lived and living experience as co-researchers conducting or collecting data, and then also in the knowledge translation of research. So how do we co-develop ways to share our findings after the research is done? And we can also look at, I think someone in our chat box actually referenced this one, and this is from the organization Involve in the UK, who have been doing public involvement in health research since 1997. And so that they define it as research that is carried out with or by members of the public rather than to, about, or for them. And when you think about it, I know within the disability movement in the 1990s, there was the term nothing about us without us. And at the Center for Healthcare Innovation, a lot of times we define engagement as people with lived and living experience of a health issue, including people who identify as patients, caregivers, families, friends, and communities, having a say in decision-making about the health research process. And as I was saying before, sometimes I find it easier to understand something by looking at what it is not. So let's take a look at what patient engagement is not. So when we're talking about patient engagement, we're not talking about people being recruited to, say, a clinical trial or another type of research study to take part in the research. So if there's study participants where you're collecting data, that wouldn't be considered patient engagement. People completing a questionnaire or participating in a focus group, again, as part of the research study where you're collecting data, that wouldn't be, because we're really wanting to engage people with lived and living experience in research decision-making, so about how the research the process goes. Also, science festivals open to the public with debates and discussion about research. That's awesome, we love it, but that wouldn't be considered patient engagement. Same with open houses at a research center where members of the public are invited to find out about research. These are all great things and ways to share research findings and to have people involved, but it wouldn't be seen as engagement because it's not around a research decision. Raising awareness through media such as television programs, newspapers, and social media, that's awesome. Knowledge translation, but again, wouldn't be considered patient engagement. Now, if you co-developed with patient partners some of those awareness tools, that would be. And then sharing research findings with participants, colleagues, or members of the public, again, wouldn't necessarily be seen as patient engagement. Now, when we think about patient engagement, there's kind of these core guiding principles. And back in 2014, SPORE laid out these principles in their patient engagement framework. The first one is inclusiveness. So really making sure that we're integrating diverse patient and public perspectives and that research actually reflects these diverse contributions. Also looking at having support for patient and public partners to be able to fully contribute to the research process. And that means creating safe environments, anti-oppressive and trauma-informed approaches, appropriate training, education, and also compensation for patient partners. Mutual respect and partnership, that means the value of experiential knowledge is recognized and by all research team members. And then with co-building, we want public patients, researchers, and practitioners working together from the beginning to identify problems and gaps, set priorities for research, and collaboratively produce and implement solutions. The co-learning aspect, that means having patient and public partners learn more about the research process, but also having researchers learn more about patient-centered engagement. As far as reciprocal relationships, again, we're talking about things like shared power and decision-making amongst researchers and patient partners. And then one of the big ones is transparency, honesty, and trust. And that means open communication, reflexive practice, and conflict resolution. And some of the core beliefs that underlie the idea of patient and public engagement is that it'll improve health outcomes and it'll enhance the healthcare system. They'll increase the quality, the appropriateness, the acceptability, the transparency, and the relevance of research. And they'll ensure that health research addresses issues of importance to people with lived and living experience of a health condition. But one thing that's really, really important to address is that not everyone identifies as a patient. People may not identify as a patient because they are unable to access the healthcare system because of geographical barriers. So when we think about people who live in rural and remote locations versus urban locations, or else also systemic barriers, including racism, colonialism, sexism, ableism, classism, homophobia, transphobia, xenophobia, sizeism, saneism, all of these different things that can create barriers to access to care. It also might be that people living with a mental health or a substance use issue where taking up the label of patient is associated with a lot of stigma. Also, people may refuse to engage with the healthcare system or prematurely exit because of disrespectful or inappropriate care. And that's why you'll often hear me throughout the sessions, throughout this lunchtime learning series as well, say things like people with lived and living experience of a health issue, and challenge us to think about who might be affected by a health issue differently, who may have different access to healthcare treatments and interventions, and how do we include all of these different perspectives so that any patient engagement strategy also addresses issues of social justice and health equity, so that we're not just improving healthcare systems and treatment and care for the few, but for everyone. And there's been some work done here in Manitoba to look at these types of issues. So expanding on some of the core guiding principles already established by the SPORE patient engagement framework, particularly around the principles of inclusive engagement. So what we found when talking with communities in Manitoba was that principles like self-awareness, empathy, trust, and relationship building also really played key roles in engagement. And the idea that patient and public engagement must be rooted, again, in social justice and health equity. And these are things that we'll continue to address throughout this lunchtime learning series as you continue to attend these sessions moving forward. So why should we engage? Well, if you're not convinced already, here's some reasons. We'll take a look at some examples and reasons why we want to engage. So first of all, we engage people with lived experience because it helps us identify research priorities that matter most to people living with a health condition that's being researched, right? So in a rheumatoid arthritis study, for example, researchers felt that the #1 research priority for people with lived experience was pain management. And then when they engaged patient partners in a research priority setting exercise, they discovered that fatigue was the #1 priority. And so they changed their entire research project to really look at a priority that was identified by people with lived and living experience. We also engage people with lived and living experience to help shape and clarify research questions so that they actually reflect the needs and concerns of patients and informal caregivers and communities. So in a mental health study, people with lived experience helped craft the study name and materials to reduce the potential for stigma and to reframe the entire research question, the goal of the study, as a movement towards emotional well-being rather than away from mental health challenges. And so that helped benefit as far as having that input and changing it to a strengths-based approach and question ended up meaning more people were interested in participating in the study. We also engage people with lived and living experience to help ensure that the methods that we're proposing in our study are appropriate, acceptable, and sensitive to the very real context in which patients and informal caregivers live, work, and play. So in a chronic pain study, the initial survey tool was this lengthy tool, and it was supposed to be administered over the phone. And then when they engaged people with lived experience or patient partners, they felt right away, they were saying this is a lengthy phone survey and it would create a barrier for chronic pain patients. And so they ended up shortening and redesigning the tool to be a self-reported and self-paced tool, facilitating greater ease for participants. We also engage to help ensure that researchers use outcomes that have true meaning to the lives of patients, informal caregivers, and communities. So an example of this would be in a study on the use of prescription drug for stroke patients. Stroke survivors serving as patient partners on the study identified home time, or the number of days when a patient is living at home, not hospitalized or in another institution, as a really important new outcome that hadn't been considered by the research team. And so this input from patient partners was vital in directing the study towards an outcome that they truly cared about. We also engage people with lived experience to ensure that the language and the content of the information that's provided to participants in studies is appropriate and acceptable. So everything from questionnaires to consent forms, patient participant leaflets, all of those different things. I know in a pediatric clinical trial project, parent partners actually helped inform the protocol of the study, as well as looking at the recruitment materials and the consent forms, so that it was easier for parents who were participants to be able to engage and be participants in the project. We also engage to help increase participation, again, in research study by making sure the research is appropriate and acceptable to potential partners, but also improving the information provided so people can make informed choices and help include voices sometimes that are traditionally less heard in research. In a pediatric surgery study, patient partners shared that were they being approached to participate in the study, they'd feel more comfortable if the person discussing the risks and benefits of surgery and involved in the study was a surgeon. So when the research team made that adjustment to the protocol, all of a sudden the rates of recruitment increased. We also engaged in the conduct of data collection in a way that will help put participants kind of at ease and provide more in-depth coverage. And we see this a lot in qualitative research, where we'll have patient partners as co-interviewers or co-facilitators in a focus group. There's also involvement of people with lived and living experience on things like data safety monitoring boards as well, that we see going on sometimes. We also engage people in the interpretation of research findings from the perspective of people with lived and living experience, so people can inform recommendations that come out. And patients and caregivers can help in the theming and analysis of qualitative data, often identifying themes that the researchers haven't even thought of, because They weren't looking at it from the perspective of people with lived experience. And this is a perfect spot just to note for our friends on the quantitative side. So whether you're a researcher or a student who works in quantitative research, or you're a person with lived experience who may be interested or who has gotten engaged in quantitative research. And when I say quantitative, it just means numbers. The qualitative side is all interviews and verbal. But the one big thing that I always like to remind people is that even when we're looking at numbers, it's still really important to engage people with lived experience. And I love this quote from Walter and Anderson. It's from their book, Indigenous Statistics, a Quantitative Research Methodology. And they say, statistics are powerful persuaders. As systematically collected numerical facts, they do much more than summarize reality in numbers. They also interpret reality and influence the way we understand society. The researchers who create statistics leave their mark on them, not just because people are biased in overt or conscious ways, but also because social, cultural, economic, and political perspectives infuse the research data, even when we think we are just counting people. So this really just is that reminder that we can engage people with lived experience even around numbers and statistics. And we've done it before in an administrative data project where we had people looking at the research findings, and they were statistics, but we talked about what is the story behind these statistics, what's missing, what's the context that we might be missing from this story, how does it align with your personal experience, and how do we interpret that data from there. We can also engage people to help co-develop ways to share your research findings. In a large pragmatic study about chronic pain, physical therapists partnering in the study designed this continuing education program that was delivered not only as part of the intervention, but also as a dissemination tool afterwards. But patient partners really contributed in the co-development of this continuing education program by providing feedback on what kind of therapy and communication techniques would be more or less likely to be effective during an acute pain episode. And then also to identify a wider set of research topics or new areas of research. So I've heard many times from researchers, even clinician researchers anecdotally, there was one investigating areas of treatment around sepsis. And when they started discussing with survivors and caregivers of sepsis, they found out that one of the outcome measures that was really important to them was frailty. And so they started a whole other area of research around this topic and had they not engaged with people with lived experience, they would have never kind of discovered this other area to take a look at in research. And then finally, engaging people to help ensure that the research reflects the concerns, the interests, the values of those with lived and living experience, and that money and resources are used adequately. We see this in things like Indigenous community engagement and health research, and things like the OCAP principles that are laid out, where research that is being done reflects what communities identify as important to them, to their community, versus what researchers think are important. And this can include grounding research in a strengths-based and resiliency-based lens versus a deficit lens, and making sure that design and methodology truly reflects the values of community. So when you start delving into patient engagement, you'll start to hear things like levels of engagement, which I'll give a brief overview right now, but really it's something we'll continue to discuss in future sessions as well. So determining at what level, you may have seen this before, it's actually seen as a spectrum. So the levels of engagement kind of go from minimal to all the way to very inclusive engagement. It's seen as a spectrum, all of these things. So at the consultation level, so at the number one, the primary goal at the consultation level of patient engagement is to obtain feedback and input from people with lived and living experience. And this is considered kind of the lowest level of involvement because researchers still maintain all of the decision-making power when it comes to the research process. And a lot of times it's about getting feedback from patients on research priorities or questions that may have already started to be developed by researchers. In the involved level, at the involved level, we're really looking at working directly with patients or members of the public throughout the research process. So especially at the planning stage, to ensure that their hopes and their concerns are really clearly understood and considered, and the research process directly reflects their aspirations and apprehensions. And some of the big things in these levels is that it's really important to have a clear understanding about which decisions in the research process people with lived and living experience can truly inform, right? That you are flexible and adaptable enough to make changes should they say, you know, the design should be a little bit different, or we should be looking at this, or we should add this outcome measure. And also making sure that you're continually communicating with people with lived experience about what level you're engaging, how you're using any of their feedback to make changes to the research process. At the collaborate level, this is where we are actively partnering with patients or members of the public in every aspect of the research process, including the research priorities, the research question, the design, the data collection approaches, the outcome measures we're going to use, the analysis of the results and the dissemination of the findings. And it's seen as kind of an ongoing partnership where members of the public might collaborate with researchers and developing everything, the research grant application, and be part of the advisory committee as well. And so this is where there is shared decision making. So this is when you need to start thinking about participatory approaches where you can engage in shared decision making. And you also need to think about things like anti-oppressive practice and making sure that all of the engagement is meaningful and authentic. And then at the patient and public directed phase, this is like the ultimate. Sometimes we call it user controlled or user led research, or sometimes you hear community led research. And this is when patients or members of the community actively control, direct, and manage the research process. So patients or members of the public decide on the issues and the questions to be looked at, as well as the way the research is designed, planned, and written up. And patients or members of the public will run the research advisory and steering group and may decide to carry out the research themselves. At this level of involvement, the role of the researcher a lot of times is either to train and support peer researchers, or else to conduct the research under the guidance and the guidance and management of the community members. And the big thing to remember at that level is that community and people with lived experience are the ones making all the decisions. And so depending on what level of engagement you choose to use, and the big thing is at every phase and stage of the research process, you can actually look at different levels of engagement, right? So maybe you don't have enough opportunity to engage people at the outcome measure stage, but at the knowledge translation stage, you do have more opportunities for people to inform the decision making or the co-development. But just really thinking through which parts of your study you can engage people with lived experience and then at what level. And one thing that we always advise is also talking to people with lived experience and community to find out what level they prefer to be engaged at as well. But there's also at every level, there's different types of participatory approaches that you can use in order to do shared decision making, right? Because that can be sometimes hard to do. So there's lots of different options on ways to engage in that. And we'll go through that in further detail, I think, as as our sessions go on. And then some of the tools and resources that might be of interest to you. First of all, there's our team here at CHI. Every province and territory has a support unit. Here in Manitoba, this is our patient engagement team. There's Dr. Kate Sibley, who does a lot of research and patient engagement. There is myself that helps lead the strategy. There's wonderful Trish who introduced us here, and she brings an amazing KT lens and also a how do we engage in quantitative research lens. And then Guy, who is away on mat leave right now, but she brings that kind of social worker lens and qualitative side of things as well. So we're always around. We have the lunchtime learning. It's monthly. It's every second Wednesday of the month over the noon hour. In October, it's actually going to be one of our grand rounds. So look out for that. I think it's October 12th. And the topic, I think, will be around engagement and homelessness. And so I think that will be an amazing one. And keep an eye out for that. But yeah, come and join us every month. We're here talking about different case studies and different ideas around engagement. For researchers, students, and community partners in Manitoba, we offer a free 1-hour consult where we can sit down with you and just talk about whether you're thinking about doing some engagement in your research, advice on recruitment or trauma-informed practice or any of those things. We're always available. And you can just go to our website, and there's like this intake form on the first page that you can see, and you can fill out an intake form, and then we'll be in touch. We also have a lovely blog series on Medium. The blog is called Knowledge Nudge, and we have a whole patient engagement section that has over 30 blog posts about patient engagement, all sorts, from the very beginner to you know, more in-depth looks. We have an online budgeting tool that you can use that the amazing Trish put together. And it's a really neat tool. It helps you think about how to do inclusive engagement and how to compensate and what things you need to think about in building a budget for engagement. And you can even kind of attach the final thing to your grant application if you are a student or a researcher. We have a methods of engagement book as well that goes through different participatory approaches and phases and stages of the research process. So that one's neat to take a look at, kind of different ways to engage. Our readiness to engage workbook as well is great for research teams, both researchers and patient partners at the beginning of engagement. There's a fillable PDF where you can answer different questions. For those of you again in Manitoba, we always have an updated counseling and resources list available on our website that you can have on hand when you're doing engagement. And it's a lot of free and low cost resources and support. So if you're doing engagement and someone needs some additional help outside of the activity, you can use this sheet.
I'll just note here too that we do have more recent update that's just been completed. We're waiting to have it loaded to the website. So if this is something you want to use right away, just shoot me an email and I can send you the updated version.
Nice. I forgot. Thanks for reminding, Trish. We also have this great one-pager if you're thinking when you're starting to plan out sending out a call or recruiting patient partners. This is like a great kind of little guide on what kind of things you want to think about in a call out to potential patient partners. And we've done some work around incorporating trauma-informed intersectional analysis in patient engagement. And we also have, you saw at I showed you a little bit of the trauma-informed, the Valuing All Voices framework. And so there's some work around the validation of that framework. And then there's also some work around engaging or surveying Manitoban researchers around what they want to see in engagement. And that it's from 2015, but it still gives some interesting insight. Now, before a big announcement, I'll open it up to questions. I know it's a lot of information all at once.
So everyone should have the option to unmute themselves or pop things into the chat if you have questions. If you don't, that's okay. It's a lot of information at once.
No pressure.
So I don't see anybody at this moment with questions. That's totally fine. Where to find the workbooks and call out sheet. So everything is on our website. I did put the link in the chat, but also everyone who registered, I'll make sure to send you all the information. So the link to the recording, the slides, and all the links that you'll need for all those resources that Carolyn mentioned. No problem.
Amazing. Thanks.
And then I did put the so is it my turn to wrap up? Do I get to?
Yes, I'm
No,
handing it over to
okay,
Trish.
okay.
Exciting announcement.
So just before I do that, I've shared the link to the evaluation for the session in the chat. And maybe just while I'm chatting, open that up and complete that for us. Please do this. It should only take a couple of minutes and it provides us with really valuable information so we can continuously improve these sessions and make sure they're meeting your needs. So I would very much appreciate if you did that. And as I mentioned, info will be sent to everyone who registered, as well as a link to register for the next session. Okay, now I get to do the honors. So today is the official launch of our Preparing for Research by Engaging Patient and Public Partners, or PrEP award. And this is intended for the very early stages of research. So when you're in the planning and grant development stage, that survey Carolyn mentioned, one of the things we found was that people have trouble engaging in those early stages because they don't yet have funds. And so the PrEP award was established back in 2017, I think, to address this need. And so applications are now open. You can find that also on our website. You can apply anytime before November 14th at 5 p.m. We'll also provide that link to you. Please share with anyone who might be interested. Anyone doing health research who wants to engage in some decision making at the early stages in Manitoba is welcome, including students, including community organizations. So please share that with your networks. We also have this year the inaugural Dr. Waterman Sirsakaldi Memorial PrEP Award. She was one of our colleagues and a very active advocate for the involvement of patients and the public in health research, specifically with regards to data and data analysis. And so this award specifically is for those initial stages of research in technology, engineering, or data science, an area we don't typically see a lot of engagement in. So we would really appreciate if you could share this with anyone working in these areas, often quantitative. This is to get them started working with people with lived experience and bringing them into their research, as I'm sure Waterman would have appreciated. And as we know, it's often a new field for people. You might not think you're eligible. Other people might not think they're eligible. You might not know, how do I get started? So we are holding an information session on October 5th about the PrEP Awards. All of this is on our website. I'll pop the link directly to the PrEP Awards in the chat, but this is open to everyone and will help you, give you an idea of kind of what makes a strong application for the PrEP Awards.